Hi, this is Dr. Farley. I want to go over this little booklet here. I pulled it out for a patient, and I thought that the blog this week should be a review of this. And the title of this is Psychiatric Drugs Create Violence and Suicide, School Shootings and Other Acts of Senseless Violence. So in here, I just want to go over a couple things with you. Law enforcement now is starting to say, as they're looking at these cases, there's two important quotes in here, and I want to just read them to you. As a veteran police officer, I found this report a vital resource for all in law enforcement. The statistics in this report are staggering, and the studies and expert opinion cannot be ignored. It is an important resource for that needs to be broadly available to our law enforcement community, our military and government officials. And that's a 29-year U.S. law enforcement professional. Second quote, as an internationally recognized expert in global terrorism and veteran federal law enforcement officer, I found this to be an exceptional report, and I'm very impressed with the quality of the investigative research. I highly recommend it as a must-keep resource for law enforcement and government. This is a resident special agent in charge from the Drug Enforcement, the DEA. Inside here, I also want to go over a couple quotes. I've been tracking this for a long time frame, and if you go way back and you look, the increased rise in suicide and homicide is very much in line with the amount of psychotropic drugs that we've been using. Here's three other quotes. The irritability and impulsivity from antidepressants can make people suicidal or homicidal. That's from Joseph Glenmullen, Harvard Medical School psychiatrist. The link between antidepressants and violence, including suicide and homicide, is well established. That's from Patrick D. Hahn, affiliate professor of biology, Loyola University, Maryland. Violence and other potentially criminal behavior caused by prescription drugs are medicine's best kept secret. That's from Professor David Healy, leading psychopharmacology expert and professor of psychiatry in Wales. A few other things to go over. If you look at the amount of antidepressants and the side effects of agitation that we see from the studies, right now there's about 41 million Americans on antidepressants, tremendous amounts of people. And if we take the 5% of people that report agitation, that's over 2 million people that can experience majorly increased agitation as they're cruising around throughout their daily life. Some other things you want to know. The U.S. psychotropic drug sales and use soar, and so does suicide, the increase. There's, from 2011 to 2015, there's been a $175 billion increase. The number of psychiatric drug prescriptions from 1999 through 2013, there were 197 million. Now there's 427 million. 79 million Americans take prescriptions that are mind-altering drugs. The suicide rate increased. In 1999, there was 10.5 per 100,000. Now there's 13 per 100,000. It's a 24% increase. And almost all of these school shootings, the thing that I see on the news over and over again, is we are now starting to focus on, well, maybe there's this thing called mental health. Well, I think we should take it a step further and say, is it mental health, or is it the psychotropic drugs that we're using for mental health that's creating these people that their brains are apparently off because they have these disorders, and then we may push them over the edge? And I believe that that's happening on a widespread basis. I personally have people that I know of that have had suicide and homicide in their own families over a time frame happen, and I believe this is what's driving it. So on my website, there's going to be a connection to this link here. It's it's called Psychiatric Drugs Create Violence and Suicide, School Shootings and Other Acts of Senseless Violence. You can read through here. It's a pretty startling report, and you're going to see that almost every time there's one of these acts of suicide or even shootings, that these drugs are involved behind the scenes. So the real question is, are these drugs creating these imbalances in these brains and pushing them over the edge? I believe they are. You can read it for yourself and see what you think as well. Otherwise, what you want to know is that what we do is we look at why the brain may not be functioning properly. We do not look at psychological causes. We look at true biomedicine causes to why the brain may not be functioning well. We try to identify what's not working well and then create a real plan aimed at correcting and restoring function. So the names of depression, anxiety, bipolar, all these are just names to describe your symptoms. They are not looking at any of the underlying mechanisms. And as it says on my website, the idea that there's a chemical imbalance going on in your brain from genetics is just not supported whatsoever by the science. So I hope you found this interesting. Thank you and have a great day.